couple minutes for questions. Okay, we were thorough. I was going to say we were very thorough.
When would you expect construction to start and people to move in?
So it depends on the readiness of a project. Existing units are also eligible. So it's conceivable that the board could award units in February and people would move in February. That'd be the earliest.
And any concerns about neighborhood pushback in areas where there would be new builds?
I think there's always concern when any new construction happens in any neighborhood, and that's part of the reason we're excited that LISC is here with us, because they've been working in a lot of these neighborhoods for much longer than I have.
Is it possible to explain briefly how the program will be sustainable after the initial government support?
Sure. So these are vouchers that the Housing Authority has, and we're really just reprioritizing and using them in a more innovative way. So as long as there's not a sequestration, these are resources that the community already has that will stay with the community.
Thank you.
Can you clarify that? Because I thought the point was that this was $100 million worth of new vouchers.
It's $100 million worth of new vouchers being targeted to end homelessness. Previously, these are vouchers that were serving our waiting list, and so this is the ability to target them and leverage them in a better way.
We learned a lot from the 100 in 100 Days program, which was, for those of you who are not familiar, housing 100 homeless veterans in 100 days. And in order to do that, which is a very aggressive goal, and it was a project through the VA, it required all of the players in this space to come together. The city, the Houston Housing Authority, Harris County Housing Authority, groups like SEARCH, the Houston Housing Department, the VA, and others. And in coming together and meeting the goal of housing 100 homeless veterans in 100 days, it gave us some ideas about how we could take that template and so house chronically homeless who weren't necessarily veterans. Where, you know, with the veterans there is a complex of supportive services through the VA and you know, already available. What can we put in place to deal with other chronically homeless individuals? And we're trying to take the lessons learned, and the Housing Authority was willing to step up and say, okay, we'll commit the vouchers as long as we have a targeted approach to getting people to use those vouchers, because we have lots and lots of folks on a waiting list for housing, but there's a difference between being in a, you know, struggling in a not very nice apartment and you'd like something better, and literally being homeless and not having any place to lay your head. And so we are targeting the homeless with this. It is a reprioritization of some of these vouchers.
Absolutely.
How long will someone be able to stay in this housing before they have to get out on their own and support themselves?
So the voucher program currently has no time limits, and there would be no time limits associated with this program.
All your programs have an income.
They are all income-based, so we're talking about low-income people. And in this case, with the permanent supportive housing, it's people who need additional assistance and supports to be stable. So a lot of times the answer is they need it without a time limit.
But obviously there's a mechanism in place as well, as if they do transition and can support themselves, have gainful employment and so forth, that certainly they're going to be encouraged to do that. But no one is chronically homeless by choice.
So it is foreseeable that some people could, because of circumstances, live in one of these units to the rest of their life.
Absolutely.
Are there any other questions? I want to thank Mr. Dunham again for not everybody likes to do public speaking, and I know he was a little bit nervous, but he's a good example of, he's a veteran, a business owner, wiped out by Katrina and health issues. Not an unusual story for a big homeless population, and to be standing here and being willing to talk about it is really great. So